Osmoprep is a medication used to clean out the intestines before a colonoscopy. It contains sodium phosphate, which is a laxative that works by drawing large amounts of water into the colon, causing watery bowel movements. This helps to clean out the intestines so that your doctor can clearly view them during the colonoscopy. It is important to note that Osmoprep should not be used for weight loss or constipation due to the possibility of severe side effects. The recommended daily dosage and optimal timing for taking Osmoprep should be discussed with your doctor before use. Before taking Osmoprep, make sure to read the medication guide provided by your pharmacist. Your doctor will determine how long before the colonoscopy you should take this product, and you should follow their directions closely. Your doctor may also provide special dietary instructions, typically recommending a period of not eating before and after the colonoscopy, and allowing only clear liquids. For the evening before your colonoscopy, you will need to take 4 tablets with at least 8 ounces of clear liquid by mouth every 15 minutes, repeating this dose until you have taken 5 doses, 20 tablets. The next day, 3 to 5 hours before the colonoscopy, you will take 4 tablets every 15 minutes until you have taken 3 doses, 12 tablets. The dosage of Osmoprep is based on your medical condition, procedure, and response to treatment. Make sure not to use a higher dose or more often than directed by your doctor. It's also important to take your other medications as directed by your doctor, typically at least 1 hour before or 1 hour after taking Osmoprep. It's important to note that you should not use any other laxative products while taking Osmoprep or for 7 days after treatment is finished, as it may increase your risk for severe side effects. Watery bowel movements typically begin 1 hour after taking the tablets, and it's recommended to drink as many clear liquids as possible before, during, and after taking this medication to prevent dehydration. If you experience watery bowel movements from Osmoprep, make sure to consult your doctor or pharmacist about how to minimize the effect and contact your doctor if you do not have a bowel movement within 3 hours after taking this medication. Some common side effects of Osmoprep include nausea, vomiting, stomach pain, dizziness, and headache. If any of these effects persist or worsen, seek medical help. It's important to note that this medication has been prescribed because the benefit to you is greater than the risk of side effects for most people. However, vomiting or diarrhea that doesn't stop can lead to dehydration and electrolyte imbalance, which may cause serious side effects to the kidneys and heart. Contact your doctor immediately if you notice any symptoms of dehydration, such as decreased urination, dry mouth, increased thirst, lack of tears, dizziness, muscle weakness, or pale skin. Additionally, it's important to seek medical help if you experience severe or persistent stomach pain, black or bloody stools, rectal bleeding, mental or mood changes, fast or irregular heartbeat, chest pain, fainting, seizures, or signs of a serious allergic reaction such as rash, itching, swelling, severe dizziness, or trouble breathing. Remember that this is not a complete list of possible side effects, so if you experience any other effects, contact your doctor or pharmacist. It's important to discuss any concerns or questions you have about Osmoprep with your healthcare provider. Serious kidney problems have occurred rarely with the use of Osmoprep. If you have kidney disease, bowel problems, severe dehydration, or are older than 55 years, you may be at a higher risk. Taking certain medications that can affect the kidneys can also increase the risk. If any of these apply to you, talk with your doctor before using Osmoprep. It's important to drink plenty of clear fluids to help prevent dehydration. The usual dosage for Osmoprep is 20 tablets taken the night before and 20 tablets taken the morning of the colonoscopy. It is best to take Osmoprep at least 1 hour before or 1 hour after consuming any food, liquid, or other medications. Be sure to follow your doctor's instructions carefully. Make sure to talk to your doctor or pharmacist before taking Osmoprep if you have any allergies or medical history of heart problems, stomach/bowel problems, gastric bypass/stapling, low blood minerals, dehydration, kidney problems, liver problems, salt-restricted diet, daily alcohol or sedative use, seizure problem, swallowing problems, or if you are planning to have surgery. Older adults should be cautious when taking Osmoprep as they may be more sensitive to the side effects of the drug. If you are pregnant, only use Osmoprep if it is clearly needed and discuss the risks and benefits with your doctor. It is also important to consult your doctor before using Osmoprep if you are breastfeeding. Remember to inform your doctor about all the products you use before having any surgery. It's important to be aware of potential drug interactions with Osmoprep, as they can impact how the medication works and increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Osmoprep include burosumab, drugs that may affect the kidneys, including ACE inhibitors such as lisinopril, ARBs such as valsartan, diuretics/water pills such as furosemide/hydrochlorothiazide, NSAIDs such as ibuprofen/naproxen. Be sure to discuss any potential interactions with your healthcare provider. Remember to take Osmoprep as directed by your doctor, and if you have any concerns or questions, don't hesitate to reach out to them for guidance. If someone has taken too much Osmoprep and experiences severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical attention by calling 911 or a poison control center. In the U.S., residents can contact their local poison control center at 1-800-222-1222, while Canadian residents can reach out to a provincial poison control center. It's important not to share Osmoprep with anyone else. While taking Osmoprep, you may need to undergo lab tests to monitor your blood mineral levels, EKG, and kidney function. Be sure to keep all of your scheduled medical and lab appointments. If you have any questions about these tests, consult your doctor for more information. If you forget to take a dose of Osmoprep, make sure to consult your doctor or pharmacist for guidance. It's important not to take a double dose to make up for the missed one. Remember to take Osmoprep as directed by your healthcare provider for the best results. Keep Osmoprep at room temperature, away from light and moisture. Make sure to store it in a place that's not the bathroom, and keep it away from children and pets. If you no longer need Osmoprep or it's expired, consult your pharmacist or local waste disposal company for proper disposal instructions. And remember, don't flush it down the toilet or pour it into a drain unless you're instructed to do so. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.